The acid-base balance is important, and it's important, and most people with chronic illness, if you check their urine, it's very acidic. And so one of the strategies in managing any chronic illness is to reduce the acidity of the blood in the body in general and the tissues in particular, because oxygen dissociates from hemoglobin more effectively in the less acidic environment at an optimum pH. So one strategy that's used for many chronic illnesses is the combination of, is to eat foods that help alkalinize the body. So you're eating away from, as the vegans like to say, things with a face. And you're eating towards you're eating more in the direction of plant-based eating. But again, even with plant-based eating, you're trying to eat products that are colorful and less refined. So refined grains, you're trying to minimize your exposure to and eat more unrefined grains. But even, and lots of colorful fruits and vegetables really help with alkalinization. Juicing can help with alkalinization. And avoiding beverages like coffee and soft drinks, and emphasizing beverages, even water with a little lemon, which is sort of counterintuitive, is alkalinizing. So interestingly, that actually helps a great deal in optimizing oxygenation. And that would, so on one hand, you'd be eating foods that support whatever, let's say, background health problem or energetic imbalance you have, but on the other hand, you'd be eating in the direction to minimize acidity and improve pH balance. Yeah?
Do you also recommend the pH plus, the drops to make your water more alkaline than acidic? Or
I think in people who are extremely ill, using a more alkaline water temporarily can actually help them feel a bit better. So when I think of that, I think of folks who are, let's say they've had a severe infection, or some people who've been exposed. There's one lady who we have a machine that alkalinizes water. I mean, I'm a gadgeteer, so of course I bought this thing. And it makes the water, water pH 8.5 or even 9.5. And this person lives in a home where there's a lot of mold exposure. And she's always been very, very ill, and she has no money. Or at least I don't think she does. So there was not that much to do for her, but at least we could check her urine pH, and it was acidic. And so she just comes and fills, gets liters of stuff a week, and that's what she drinks. And I think for her, that's been, as far as I know, helpful. She doesn't, come complaining of other things, so I take it it's working for her. And it's a nice idea, but I think you can also, in the average person, I think you can emphasize the eating idea and the drinking idea.